Hi everybody, I'm Dr. Joseph Cipriano, and today we have Mama Cip here. So after the adjustment has been made, she's still been holding a lot of tension and a lot of pressure through the neck, going into the shoulders here, and then also going down into the mid-back. As you can tell, the muscles that she's following is basically the trapezius muscles that have been kind of stiffening and cramping up on her. So what we're going to be doing here today is a technique called a trigger point therapy. And what that's going to be doing is we're going to be actually working on the soft tissue. So actually, Mama Cip, if you could kind of tell everybody what you've been feeling and, you know, like what you told me earlier.
Of course. So I've been kind of holding a lot of tension up in my upper back due to breastfeeding, constantly kind of hunched over, and just I tend to carry that tension up around the shoulders and upper back.
Okay. Well, so today what we're going to be doing, I'm just going to show everyone what it's like to actually have trigger point therapy done on you, okay? So we're going to move the patient's hair, and what I'm going to be doing, I'm literally coming around and I'm feeling down through the neck, going to the base of the neck where the neck actually meets the thoracic spine, and right through here, I'm finding the areas that are very tight and where you can really feel that muscle knot. And I like to push and hold. Every time when I find that area, I like to push and hold for about 5 seconds at a time. And I'm not gonna lie, this is not the most comfortable thing done at all.
No.
How does that feel?
A little painful, I'll be honest.
Okay.
But I feel like I need it.
So this is one of those things where it's kind of like pain is pleasure with this, because as I'm coming in and pushing in, I mean, you can really see, and she's kind of holding in a little bit of the facial expression of what's going on. And I'm literally, patient has so much hair here, I literally am making my way down her back, and I really try to get underneath her scapula, with her shoulder blades is what people tend to call it. So what I'll do is I'll get right under there and I will push and hold, and I'll dig my thumb in there and I hold for, as I said, about 5 seconds, and I go through and I do that on each side, literally 1, 2, 3, 4, 5, and I relax, come through, and all I'm doing, I'm going through, I'm feeling where those knots and where those very tight parts on her back are, and I'm going to help push them out.
Oh my God.
Okay, so this, as I was saying, this is your trigger point therapy technique. It's a soft tissue design technique, but it really does work wonders. It goes hand in hand with chiropractic care. So a lot of the times with the chiropractic care, the whole point of that is the muscles and ligaments are what connect to the actual spine and to the actual bone. But what happens is when the muscles pull the bone out of alignment, they become inflamed, and you can really start feeling the knot. So once you make that adjustment and realign the spine, you still have those muscles that are taut and tender. So that's why after the adjustment, we can go through with the trigger point therapy and really work on those areas. So then what that's going to do is it's going to cause her to actually hold her adjustments longer, because if the muscle isn't trying to pull on the spine, that's going to cause her body to actually hold that adjustment longer, which actually is less visits to me. But so as you can tell, it's simply we're going through, we're pushing in, and we're holding for 5 seconds, and we're going all the way through, all the way down. As you can tell, if you come right in, you see where, so I bring her shoulder back, and I'm really getting in underneath her shoulder blade here. Hold that for 5 seconds, and once we start getting that movement and we're basically tearing the muscle off the scapula, and what's happening is there's a lot of pressure getting relieved, and a lot of those knots and the muscle aches will tend to go away with that. So that is a trigger point therapy technique. I'm Dr. Joseph Cipriano, and great having you guys on tonight, and I love showing you guys new things all the time. Have a good one, like and subscribe.